Okay, getting a lot of questions about PEMF therapy. So this chair is the therapy. The mat here has coils inside, and whenever the machine is turned on, these coils produce a pulse magnetic fields that go all the way through you. So this chair is the therapy chair. This machine here is what delivers the pulse magnetic fields. And we have attachments like these pads that you can put over any part of your body, over your head, your heart, any area on your body will be okay. It's perfectly safe to use anywhere. So when you come in here to do a therapy, we will turn on the machine. We're going to set the time, the pulses per second, and we'll turn it on. And basically there is a knob here that increases the intensity. Now you'll be in control of that, so you'll turn this up until it's comfortable for you. Now when you first sit down, you will start turning up the intensity. The first thing that you're going to do is you're going to hear a tapping sensation. Tap, 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 tap. You may be able to pick this up, I'm not sure. So you turn this up, you hear it first, and then you feel it somewhere on your body. So when the machine is turned up into an intensity that you can feel, it'll feel like somebody's just tapping you on a certain part of your body. Now right now, I feel it tapping right here, and I know that's my gallbladder because I ate just a few minutes ago, so that makes sense. So you feel this in areas where your body needs the most support. So if you continue to turn up the intensity, one of two things is going to happen. Either you will feel it in the area where you felt it initially, it just becomes more intense, or it will go to other areas of your body where you have a problem. So this therapy will actually isolate an area where you have a problem. So if you come in and you have a bad back or a bad shoulder or a bad knee or whatever, this will pick that up. It will go to these areas where you have increased inflammation, decreased circulation, low cellular energy, or some tissues that need to be repaired. So when I turn this up and continue to turn it up, I feel it in other areas. I feel it in my left shoulder. So I turn it up, and you can. This machine is strong enough or powerful enough to actually cause muscle contractions. I'm going to demonstrate that for you, just so that you'll see what I'm talking about. But understand that more is not better, and that you don't have to turn it up to the point where it causes muscle contractions. I'm just going to demonstrate this. Okay, so I'm turning it up, and I don't know if you can pick this up on here, but it's actually causing muscle contractions. My body is starting to get muscle contractions, and I'm hoping this picks it up on here. I don't know if it is or not, but there's no need to turn it up that high. So you can turn it down to an intensity where you can feel it, but it's comfortable. It's not uncomfortable. It's not shocking you. This is just you're getting muscle contractions because this pulse magnetic field is coming all the way through this chair, all the way through your body. So if you held a magnet in front of your body, you can actually feel the magnetic wave as it goes through. So the penetration of this machine is the most that you can get because it goes all the way through your body. So when we hit the specific frequency that you need and the time that you turn it up to a point that's comfortable. Now, if we're doing something like an enlarged prostate, if you have an enlarged prostate, if you have urinary incontinence, we will put these pads right over your lap. Now, you will feel this, but it's not going to be uncomfortable. And if you don't want to feel anything, you can actually turn it down to the point where you don't feel anything, but it's still working. So it's still doing the job that it's meant to do, and that is pulse magnetic field through your body. Because when a pulse magnetic field goes through your body, it decreases inflammation, it increases circulation, it increases cellular energy, it increases cellular oxygenation, and if you've got something that's stuck on your cells, blocking the cell receptor sites, it will actually knock those off. And also, if you've got toxins in your cells, a lot of times what happens when these chronic conditions go on for too long, your cells should be big, round, and robust. But over time, when your cells start to lose energy, they start to become like a deflated ball. And the reason for that is about 30 to 40% of your cell's energy is needed just to maintain the gradient, basically the shape of the cell, meaning the inside and outside. They need to keep that at a certain difference in millivolts. And if that doesn't happen, if the cell starts to lose its charge, it doesn't have enough energy to maintain that. The cell actually starts to deflate. Now, when this happens, if you don't have something like a PEMF device, you're not going to be able to bring those cells back. But with a PEMF device like this, you can actually bring those cells back, because the reason that they collapsed on themselves is because they can't get oxygen, nutrients, and hormones into the cell. And it may be because you got inflammation, decreased circulation. It may be because you got blocked receptor sites, or it may be because you've got so many toxins in there that the cell can't function properly, and the cell's lost so much energy that it can't do anything. But the PEMF therapy will actually increase the energy of the cell, allowing it to become bigger, more robust. Now, when you make changes, where you change your diet, and you give your body or take the nutraceuticals that your cells need to function properly, now you can actually get those into the cells. And before, when I was practicing functional medicine, there was about 15% of the people who I couldn't help, because even though we did all the proper blood work, we knew what the underlying issues were, we knew what we needed to correct those underlying issues, we could not do that because the cell was so low energy. It had so much toxins in it, it had blocked receptor sites, that even if we did make the changes, we started eating better, we started taking the right nutraceuticals, exercise, and all these things that we're supposed to do to regain our health, didn't matter, because the nutrients, the oxygen, nutrients, and hormones wouldn't be able to get into the cell. So the cells couldn't need it. But with a PEMF device, you can actually increase the energy. Cell becomes bigger, got more energy, knock off receptor sites, things that are blocking these receptor sites, decrease inflammation, increase the circulation, increase cellular oxygenation, increase cellular energy, and you're working at problems on a cellular level. And when you do that, it doesn't matter what disease, syndrome, or condition that you have. When you're addressing problems at the cellular level with functional medicine and a high-intensity PEMF device, there's very little that you can't help, because we don't claim to treat anything, because, well, treating anything doesn't work. If you treat something, if you got a chronic condition and you treat it, you're likely to be taking medication for the rest of your life. What we're looking at is what's the underlying cause of the problem? Why is this happening, and what can we do? What steps can we take to undo that, to make changes so that your body starts functioning the way that it should? Now, I hope that this answers any questions you may have. This therapy is perfectly safe. PEMF therapy has been studied in over 2,000 double-blind, placebo-controlled medical studies on virtually every chronic condition known to man, with no long-term side effects being reported. The effects that we've seen in our office, increased energy, decreased pain, and so many other things. I mean, when you're addressing problems at the cellular level with the PEMF therapy and the functional medicine, there's very little that you can't make better.